Good morning, everybody. As some of you might know, I'm Tony from Mercy Perrysburg Family Medicine. As we do the third Wednesday of each month, give a talk on a different medical topic. And today we have Dr. Casillas from our residency program that's going to talk about dementia. There are a lot of things we worry about as we get older. Heart attacks, stroke, dementia. There are things that we know have the ability to restrict our independence, or we might be caring for somebody who's been subjected to those types of setbacks. So today, Dr. Casillas is going to talk about dementia in general, but there's over 100 different kinds of dementia. So she's going to focus on just a few. She's going to focus on what kind of testing is necessary to reach a diagnosis of dementia. She's going to talk about some types of treatments and prevention, and then resources. So I'm going to turn it over to her. We'll stick around in case you have any personal questions.
All right. Hi, everyone. Hi. So my name is Dr. Casillas. So I'm a second-year resident with Mercy Perrysburg. So I am here to talk about dementia. And this topic is very important because, as the population is aging, we're seeing more and more cases. So it's good to see, some of those symptoms, those beginning symptoms, and what you can do about it to prevent it. And and of course something happens.
Well, we might be able to just advance it here.
Okay.
That's gonna be my guess. Nope. Nope. Nope.
Maybe if I
Ah.
there. Okay, I just had to click on the okay.
All right.
Thanks.
Did that work?
Yeah, I did. Okay, so what is dementia? So dementia is a term that it describes a group of brain disorders. So it's not just one thing that cause memory and thinking issues. And this can cause problems to your daily life activities. So why is this relevant? So this is the 5th leading cause of death after the age of 65. Yeah, so it's actually very up there, even though we don't really think about it as, one of the leading causes of death. And then by the year 2060, it's supposed to double in cases. Especially as, the aging population of the baby boomers. It's a big population, and so, once they age, it's like there's going to be a lot more population of elderly. And then people are also living longer and greater risk as you age. What are the different types of dementia? So there are, just as Tony had said, there are hundreds of different types. But the ones that we're more familiar with, you might have heard of Alzheimer's. That's the #1 case that we see. And that usually starts off with some memory problems and then progresses. Some other types as Parkinson's disease dementia. So Parkinson's is a disease where it first affects your the movement, so the way that you move. It causes a lot of rigidity. You see someone has like a stooped position and a shuffling gait. But unfortunately, it starts off that way and eventually can lead to memory problems as well. Another one is vascular dementia, and this is caused by strokes or loss of oxygen to the brain. So having lots of strokes can affect how your brain gets blood flow in there, as well as if someone has a history of sleep apnea. When you sleep, they lose oxygen when they sleep, so that can lead to a type of vascular dementia. Other types are Lewy body dementia, and what's notable about this one, it causes hallucinations. So, there's like little variations of the different types of dementia. And one that's a little more devastating is the frontal temporal dementia, because it can affect people as young as 40. So that one, it affects people very young. But then it starts getting similar type of symptoms with behavior problems and memory problems. So some symptoms that someone may start off with, and then it becomes more severe over time, as forgetfulness, some memory loss. So of course, it is normal to have a little bit of memory loss as someone ages. That's okay, forgetting your keys or something very simple, but it's a lot worse when it starts to progress and you start forgetting where you are and who your family members are. Some other things that dementia can affect are performing daily activities, such as taking medications and even, taking care of your hygiene, even forgetting how to eat or to eat, like you lose appetite. And there are also, it can also progress to having communication problems where someone may not even be able to speak anymore. So those are, like the variability of the different symptoms. Some screenings that you actually may have already done yourself, in the clinical setting, if a physician has suspicion for, some memory problems and they want to make sure it's not extensive, they may do what's called the mini mental health exam or a mini cog exam. And that includes, if you ever done the drawing the clock, if they ask you to draw a clock, and they'll give you a time, or they'll ask you to remember a few words, or they'll tell you a story and ask questions. So those are some things on how to evaluate how your memory and like train of thought is doing. Some very important screenings is to rule out other things that may mimic dementia. So there are other diseases, disorders that may be reversible, and we have to rule those out before diagnosing dementia. So that includes screening for depression. Depression affects the brain with the memory and thinking, because sometimes depression can make you sleep less or sleep longer, and so it does affect how your brain is thinking. Some other screenings are doing some lab work to check that you don't have a thyroid issue or vitamin deficiencies that can also make you more fatigued, or make you have some memory problems just because you're more fatigued or tired. Some other things are to check for anemia or diabetes. So there's a lot of different things that you have to check before you go straight to the diagnosis of dementia. And some imaging that physicians might do is a head CT or MRI, just to rule out other causes. You want to make sure it's not something else happening in the brain, like rule out any like brain tumors or any like acute strokes. So some preventative things that we want to control before you get dementia. There's things that they are in control and not in control of. So for example, we can't really control air pollution unless you move to somewhere that doesn't have a lot of air pollution, so out of a big city. Education is one thing too that we can and can control, so we can't control how much education you got when you're, a little, like a child, but. As you're older, you could start learning new things, then that helps your brain process and keep, active. Some other things that we can control is like high cholesterol. Make sure that your cholesterol is under control. So you have less risks for things like stroke, right? So that was one of the types of dementia. Head injury. So we want to make sure that you are careful. So for younger people, that would be, wearing a helmet or being careful. But, when you're older, it's more about preventing falls, right? So more falls can lead to more brain injury, and that can also lead to types of dementia. Being physically active. So that, it decreases all of those other risks, such as obesity and hypertension. So everything goes hand in hand. I feel like you guys are already doing a great job being here, because one of the things is social contact. If you're more social, that also helps with your brain processing. So you guys are already, you're learning, you're being social, so you guys are already doing a great job. Some other things are, like we said before, preventing by helping with some of those chronic diseases like diabetes, depression, not, having less toxins like smoking and alcohol, because those things can affect the way your brain works as well. So here's a little bit more information of prevention. So like doing more mind games or puzzles, so that also helps the way your brain processes things. Visiting friends and family, seeing your optometrist, doing things to prevent, blindness. Like if you have cataracts, you want to like prevent all that or get that fixed so that you don't lose your eyesight, and then that, so everything builds up and you lose a lot of those different processes in your brain. So like your sense of hearing and seeing and all of that helps with your brain processing and prevents dementia. So it's recommended you see your family doctor regularly, about 3 to 6 months. So it depends on your chronic conditions. And then getting enough sleep, which is very important, because that's when your brain processes your memories. So that's, I feel like one of the big key points is trying to get good sleep. So there's a few myths about prevention. There's no proven research about which supplements are effective in preventing dementia. So I know sometimes people have talked about vitamin E or ginkgo biloba or coconut oil, but these things aren't proven. They certainly don't harm, but it's not the only thing that you should be taking in. There's other things you can do to help with your risks, such as controlling your chronic conditions, or being more physically active, more social. So there's other things you can do. So treatment, there's no cure for dementia, unfortunately, but there are ways to slow the progression. So some things that you can do are controlling your chronic conditions. You can also reduce symptoms. If somebody already has dementia, some things that can help with their behavior is redirection, repetition, or reassurance. some good things to do for them is if they have photographs of their family, that helps them. I talked with one of a psychologist, and he's recommended having aromatherapy too, because that induces a lot of memories, so that helps as well. And also listening to music. So that's a good way to, you know, keep somebody calm and have those nice memories. And so I have a little bit information about caregivers, because you know, that's a big thing is caregiver burnout. You know, dealing or taking care of a family member or a friend with dementia is very taxing, especially if you're, you know, having to do that and also taking care of, you know, your own family and your own job. There's lots of stress. So it's very important for caregivers to make sure they take care of themselves. There are resources out there to help with different support groups. So I listed a few here, including the Family Caregiver Alliance. So there's a number there for them, the Elder Care Locator Service, and then the Alzheimer's Association. So you can get more information there, or even, you know, for if you have a friend that may need some information, there's